So the point I want to make is that the analyst always has to be interpreting. And Freud, as you know, was an excellent interpreter, an excellent analyst, and he was able to figure out how the human mind works and how his own mind worked, and he made a great deal, many important and wonderful discoveries, until he came to the problem of the pre-Oedipal personality, where a classical analysis and interpretive analysis fails. And I've already hinted at it why it fails, because the person doesn't respond to being told what's wrong with him. The person responds to an intervention which meets a maturational need in the patient at the moment. And if the maturational need is not met, the patient does not improve. Many of you have heard me say that the job of the analyst is not to meet the maturational needs of the patient, and that still is correct. The job of the analyst is to resolve the patient's resistance. The question is, what's the difference in the therapeutic advantage of a negative or positive transference? When I first started to do analytic work, I used to like to have my patients like me. And it really was very rewarding to have patients come in and tell you what a wonderful doctor you are and how nice you are. And I thought I was getting positive transferences, and I would be very appreciative and thank the patient and tell them how nice they were. And we would have a very nice time together, but nothing happened. I mean, there was no analytic results, as far as I could tell, with many of my patients. Some patients, with one patient in particular, I remember, I got very dissatisfied with how things are going, and I decided I'll just keep my mouth shut. I won't talk. So I didn't talk for at least 6 months with that patient to see what would happen. Then I got the negative transference. The patient became very negative toward me, and as a result of that negative transfer, the patient started to improve. And that's the big advantage of a negative transference. If they get it and the patient tell you about it, they improve. The reason for that is, if you do what Freud did, if you try to figure out why does the patient improve when they hate you, well, it turns out, because they hated their mother and they hated their father. And if they tell you that they hate you the way they hated their mother and father, if they come up with a negative transference, then all the rage and anger that's been kept in over the years is expressed toward the analyst. And since the father and mother do not permit you to come out with that rage, and if you're a good analyst, you accept it from the patient, then the patient finds that even with his rage and anger or the negative transfer, he's an acceptable human being. He's got a right to live in this world of function. So then patients get better.